Hello everyone, I'm Anastasia signing in from NORAS. So in our previous sessions, as we have started discussing about the bowel elimination, till now we have discussed about the physiology, about the composition, about the normal and the abnormal characteristics of stool, about the factors affecting and even the alterations in the bowel elimination. In this session, we will be discussing about the collection of these two specimens. Here, a stool test, also known as a fecal sample test, a stool sample test, or even a stool culture, is done in order to diagnose certain medical conditions such as the inflammatory bowel disease, the anal fissure, hemorrhoids, the rectal or the gastric cancer, as well as to detect the presence of blood or mucus in the stool. So it is very important that we first must know the composition and the normal characteristics of the stool sample, because here once the stool is collected, we will be able to find out whether the person is suffering from any disease condition or not, based on the observation, based on the characteristics which is present in that stool sample. Here, this stool analysis is used to aid in diagnosing disorders related to gastrointestinal bleeding, as well as to the therapy which a person is undergoing that can lead to presence of bleeding. To assist in the diagnosis of pseudomembranous enterocolitis following the use of broad-spectrum antibiotic therapy, this can also be done, as I've said, in order to diagnose if there is presence of inflammatory bowel diseases, or to diagnose the suspected inflammatory bowel syndrome. This is also done in order to identify the cause of diarrhea if a person is having so, to investigate the disorders of protein digestion, to screen for the presence of colorectal cancer, to screen for cystic fibrosis, to determine the intestinal parasitic infection as indicated by the presence of diarrhea of an unknown cause, as well as to evaluate the effectiveness of therapeutic regimen for the intestinal malabsorption, or even for the presence of pancreatic insufficiency. So these are the reasons why a stool analysis must be done. So here, when we are conducting the stool test or the stool analysis, there are also certain factors that can affect the outcome of the study. And these factors include the medications that can irritate the gastric mucosa, such as the non-steroidal anti-inflammatory medications, the corticosteroids, the anticoagulants, and also certain iron preparation that can cause a positive result for occult blood. The high doses of vitamin C, which is more than 250 mg per day, can also lead to a false negative occult blood. The dietary intake, which is high in red meat, certain vegetables such as the cauliflower, the broccoli, radish, turnip, as well as certain fruits such as the apple and the banana, can also cause false positive results for occult blood. Not only that, but a constipated stool may also not show any trypsin activity because of its prolonged exposure to the intestinal bacteria. So here, because of these factors, it it can also interfere, or we can say it can also affect the result of the study. So here we must keep in mind that we collect a detailed history, as well as we know the detailed history of the patient in order to be able to determine what are the factors that may interfere with the result, as well as what is the disease that he or she might be suffering from. So now let us discuss about the procedure for stool analysis. So this procedure consists of few steps. The first one is the collection of the fecal or the stool sample. So here what we as nurses must do is we must provide gloves to the patient. We must advise them to wear it, and then provide a container which is leak proof and has a strong lid, whereby we will be telling the patient that they must collect a small amount of their stool in this container. Whereas if we encounter patients who are bedridden, then what we can do is we can provide a clean and a dry bedpan to the patient after he or she has defecated. Then we can take a small portion of it by using a tongue blade and transfer it to the container. And if a rectal swab must be done, then here we can insert the swab 2 to 3 centimeter into the rectal splinters. We must rotate it, and then we can remove and transfer the swab in the container. So here this is how we can collect the sample from the patient. We also need to fill out the test result form completely, whereby here we will be filling the request for the laboratory test. We will be filling the patient's demography, as well as the stool consistency and the time and date at which this sample has been collected. Here we must also note that we mention if the patient has had any previous or is undergoing any antibiotic therapy. And once this is done, we must transport the specimen to the laboratory. Here, immediate transportation of the specimen must be done for processing and analysis. However, here, if immediate transportation cannot be done, then we must make sure that we store the specimen in the preservative. Now, when we talk about the stool specimen, if the specimen is liquid or soft, then if this specimen cannot be processed immediately within the 30 minutes of the collection, then we must store it in the preservative as a set. However, if it is a form specimen, then we can also store it either in the preservative or the refrigerator. So this is the procedure for stool analysis. As I've said, first we must advise the patient to collect the fecal sample, and then we must fill out the test request form. After filling this, we must transport the specimen to the laboratory. So these are the steps that you must do in this procedure. However, as a nurse, you also have certain responsibilities that you must do for this procedure, and this include assessing the patient's level of comfort before you advise the patient to perform this procedure. Here, as we know that collection of stool specimen can lead one to feel embarrassed or discomfort. So as a nurse, you must make sure that you assess their level of comfort so that you can explain it to them. You can tell them why is this specimen required, and also by telling them the reason, by counseling them, it will help to improve their comfort level. You must also encourage the patient to urinate before the collection of this sample, because here when we are collecting this sample, we do not want it to be contaminated with the urine. So here it is advisable that you must tell the patient that they must first urinate and then only collect the sample to prevent it from contamination. You must also advise the patient to avoid laxative, enemas, or even suppository at least 3 days prior to the collection of this specimen, because here these may interfere with the results. So as a nurse, you must also tell them to avoid laxatives. And you must also instruct the patient to follow a red meat free and a high residue diet. So these are few of the things that you as a nurse must instruct the patient before the procedure is performed. However, after the procedure has performed, which is after the sample has been collected, so these are few of the things that you as a nurse must instruct the patient to do before the procedure is performed. However, after the procedure has been done, that is after the sample has been collected, you must instruct the patient to perform a thorough hand washing, as we know that hand washing is very important to prevent the contamination of the hands as well as to prevent cross infection. So here as a nurse, you must make sure that they have performed this hand washing thoroughly, and you can also advise them to resume their normal activities such as following their regular diet and also continuing their medication therapy until and unless it is otherwise specified. Recommends yearly occult blood tests as part of the screening for presence of colorectal cancer, especially on people who are of 45 years of age. So here as a nurse, after the procedure has been done, you must make sure that you instruct the patient to perform a thorough hand washing. You can advise them to resume back their normal activities as well as recommend them for a regular screening. So now we have come to the end of this topic, whereby in today's session we have discussed about the collection of stool specimen, where we have come to know why is this collected, what are the factors that may interfere with the result of the study, what are the various steps that we must follow for this procedure, as well as the nurse's responsibilities before and after this procedure has been performed. So I hope you have got a clear understanding of this topic. I'll be meeting you in another session where we will be discussing about the different tests that we can perform in order to detect the presence of any abnormalities in these stool specimen. So until then, have a good day. Thank you.